Welcome to the Healthcare Leadership Experience radio show with your host, Lisa Miller. Lisa is an entrepreneur, inventor, advisor, and founder of VIE Healthcare Consulting, the leading healthcare advisory and analytics firm, helping hospitals accelerate their margin improvement goals. Lisa loves to think differently and collaborates with leaders and their teams to solve challenges and to create new, innovative approaches that impact the clinical and business side of healthcare. Our show will bring you leaders and innovators within healthcare and across multiple industries. Be a part of the discussion that will give you a unique perspective, deep insights, and roadmaps to successfully help you navigate the clinical, financial, and operations of healthcare. Your show starts now.
Hello, this is the Healthcare Leadership Experience radio show on Healthcare Now Radio.
Welcome, Luis. I want to thank you for being on the Healthcare Leadership Experience. Rich and I are super excited to talk with you. Do you mind just giving us a little bit of background on your career and what you've done and what you're doing now? We would just love to have the audience to get to know you a little bit better.
Yeah, thanks for having me. I am Luis Martinez. I'm Cornerstone's Vice President of Supply Chain. I've been there for 5 years now, going on 6, about 5.5. And in my current role, I oversee all things that are kind of traditional supply chain, your materials management, your purchasing. We do the contracting for all purchase services, and then we do accounts payable, or accounts payable reports up to supply chain, I should say, at Cornerstone. Prior to joining Cornerstone, I was with MD Byline, which has since been bought. So I think they go by Track Manager now, or maybe simpler. But when I was there, I really worked with all of our accounts and members that we had there and met with all of the different leaders in supply chain, really around all spend categories, whether it's capital, consumables, or purchase services. So it was a great opportunity for me to be there and just meet peers in different ways to view supply chain, whether it's for profit, not for profit, academic, rural, whatever it may be. And prior to that, I was the director of purchasing for a hospital system, mainly with surgical, specialties, if you will. So a lot of interactions in the ORs, of course, when you have those type of hospitals and with physicians. And then prior to that, most of my experience was in the capital space, mainly equipment planning. Got a chance to be on some really neat projects. Stanford out in California and Cleveland Clinic when they opened the hospital. Gosh, it's probably been 10, 15 years now, but I got a chance to learn a lot on the capital space around that hospital and some other projects that I was on. So I've had a good career that was pretty mixed. I got a chance to see capital, disposables. I've been on the account management side. I've been on the provider side, more on the provider side. So I've gotten to see all the different views of the supply chain world.
Thank you. I really appreciate you going into that detail, because I think it'll lay a nice foundation for our conversation, because you've kind of been, like you said, more on the provider world, but you've had been the opportunity to be a little bit on that MD Byline side and kind of, see that world. So it gives you an interesting context when you're looking to really put together a supply chain strategy for Cornerstone. I think that's given you a really well-positioned view of looking at the marketplace and seeing what's best for you and the organization. And, it is unique. And I'd love to hear, your definition of why it's unique, or maybe some of the challenges, but really kind of get an overview from you, Luis, on that, purchase services space and how you see it.
Yeah, it's a different animal for supply chain, right? I mean, I think when you think about capital and you think about consumables, it's transactional. It's a line item that you purchase, and you may just purchase, if it's capital, you may purchase it once a year or once every 5 years. Consumables, you do purchase it more frequently, every week, every day, depending, the size of your organization. But purchase service is different. You get the services monthly or weekly, but you really only negotiate those every 5 years or 3 years or whatever your cycle is. And so, it's less transactional. I guess there's more risk, I should say, in a purchase services negotiation, because you're not negotiating a line item, you're negotiating contract. It's just a completely different animal. So, there's definitely the cost of services. Every delivery, may have X cost, or every pickup or every service that they provide if it's clinical. But also tied into that, right, are late fees or environmental fees, overage fees, waiting fees, right? It's just, there's all types of extra language and fine print in those purchase services contracts. So it's not the same as a transactional negotiation. And so because of that, you have to just approach it an entirely different mindset.
You mentioned the approach, and I was just curious to find out, how do you approach purchase service? So if you're all those different fees and different complicated contracts, what are your steps? Obviously it doesn't have to be 100 steps, but just curious your overall steps and then approach.
Yeah, it's a really good question. And I'll take you back to the beginning of my time, right? Beginning of my time in negotiating purchase services contracts. I think step one is understanding the service and the language, understanding the fees that I mentioned earlier, but you have to become an expert in what they're discussing. And so whether you're doing that through a Google research, where a lot of us start, or you're pulling in expertise within your organization, right? Maybe an end user, or if it's a third-party group, right, that you're bringing in to help you with that. But I think, step one, which is just understanding, really just picking apart the contract and understanding each section and saying, okay, what is this section? What does this mean? And you'd have to do that, obviously, for tons of contracts, but it's kind of breaking it down. Because as you start going and negotiating these, over and over, whether it's the same one or a different type of service, there are a lot of similarities, right, in the language. So you start learning how to kind of pick it apart. And so understanding the structure of an agreement is, I think, probably step one. And how you do that is, there's a different, like I said, you could do it internally, you could do it yourself, you could do third party, you could hire a person solely for purchase services, which was what we see a lot now, right? So they have the time to do that.
Just one follow-up question on to the approach. So, in the industry, we're seeing a lot of need for purchase services benchmarking, which obviously we provide and we work with a lot of our clients with. But do you see where in your approach, where in the process is the benchmarking? When is it required, as opposed to just a blanket benchmarks that we're seeing a lot in the marketplace?
Right. And I just want to, that's a great question, Rich, and I want to add a little to that, right? So we see a lot of this ratio benchmarking. Is it a starter? Is it non-starter? Comparisons between like-size organization with bed size or revenue. And is that useful? Is that not useful? And to Rich's point, there's some benchmarking that needs to be done locally, or, with great people doing in hospitals doing great work. And sometimes they need some supplemental benchmarking.
Yeah,
but
it is. You're right. It's a big question, and it's not an easy one to answer, because I think, number one, benchmarks have their place. And when we talk about capital and disposables, it's a little closer, right? You get closer to a benchmark and you say, okay, this is the exact same model. This is the exact same, widget. And so they should, be roughly the same price. And so, but when you get to purchase services, kind of going back to what I was saying earlier, right? With all the different aspects of a contract, it becomes a little bit more challenging. And now it does have its place. It does provide some directional opportunity for whoever's negotiating. And as a negotiator, you would want to look at that, right? If you're looking at a landscaping contract, though, it's not apples to apples, right? The size of the property may be different, or it is different at every location, right? And so it becomes challenging in that sense, but there is a place for it. I think, Rich, one of the questions that you asked is, when do you need it? And I think it's helpful in the beginning to know if what your opportunity is for negotiations, or, how deep you want to go, or if you even want to go out to bid, right? So it may give you some directional indicators in that sense, but then you use it again as you get deeper into the agreement, right, in the negotiation. So if you are able to kind of find a general benchmark that's pretty similar, then you use that to your advantage. The problem in purchase services is there's so many variables. I don't think you'll ever get an exact, benchmark because of some of the things that were said earlier, hospital size, frequency of visits. It doesn't mean it doesn't exist, but it requires a deeper dive into the benchmark to make sure you're looking at the right type of benchmark, because it could be misleading, right? And the sales folks, they become trained over the years, right, with the benchmark companies out there, is to have their rebuttals, right? To say, that's a different size hospital, it's a different region, it's a different, fill in the blank. And so if you just have a kind of a blind benchmark, you have to be prepared, for that. So I go back, I'll use, what I was saying earlier, in these purchase services, all these different agreements, right? But if you renegotiate a linen agreement and they have, language in there that says, well, we need to recoup our dollars if you terminate early, but you're up for renewal, and you say, well, you've already made money, you've gotten to your ROI and your break-even point. So there's some negotiation opportunity, I think, within there. Obviously, they're replacing product as you go, but they also factor that into the cost. So if your renewal language And the linen contract also states, hey, if you terminate early, there's a penalty. And if their rebuttal is the reason for that is we have to recoup our cost, well, this is a renewal. You've already recouped that cost plus more. Hopefully that's your business model, right? So it's just thinking through that. So if you take that as an example, the benchmark of a renewal versus a new agreement where they're investing product or capital, those are two different factors. Bulk gas has built-in tank into it. That may be a little higher, right, than one that doesn't have it, right? And so it could be misleading if you don't have all the details behind it.
Yeah, thank you. That's a great answer. And benchmarking, I think you said it well. It's complicated to figure out when to use it and how. We recognize that it's a very regional benchmarking exercise. And I think you mentioned it, I think it was greater than just the benchmarking, it's the expertise. And I really feel like hospitals have so much leverage on their own in the sense that, you can go get some insights, but sometimes the leverage that they have within their own region is tremendous. I don't know if they recognize their market power, even if they're smaller. I think that sometimes we don't talk enough about a hospital's own leverage, market power, skill set in what they can do, even if they're standalone or what have you. I think that we don't have enough of those conversations. But thank you. I think the benchmarking discussion probably could be a big discussion.
Yeah. If you're just tuning in, you are listening to the Healthcare Leadership Experience radio show on Healthcare Now Radio. And I'm Lisa Miller, your host. This show is sponsored by VIE Healthcare Consulting, the leading healthcare advisory and analytics firm helping hospitals accelerate their cost savings and margin improvement goals. We've been helping hospitals since 1999, and you can learn more about VIE Healthcare at VIEhealthcare.com.
One thing I want to mention is it's funny because, even platforms, there's a need sometimes for RFPs and sometimes there's a need just to renegotiate. And I think you mentioned that as well. And while hospitals are going through the RFPs or going through a platform or really kind of handing that off, it's important to know who's behind it and who's the expert, right? A platform can't perform an RFP and purchase services. It's not transactional. You have to have a thinking person with deep expertise has done that category a number of times throughout the country that can really sort through everything, right? I'll give you a story someone shared with me, but before I do, you would agree, right, Louis, it's just deep expertise that matters.
Oh, for sure. And, technology, like benchmarking, right? It has its place. You need it. It's a tool that you use. But to your point, and this is what I said earlier, right? Who's the expert, right? You need some expert that understands each component of what you're negotiating. And that's difficult to pull out of a benchmark sometimes. Sometimes it's there. Sometimes it's a little bit more complex. And it's the same situation with technology. Sometimes it's perfect for it. But a lot of times it's deeper that you need somebody who has done it before, or has taken the time to learn it, so that they're prepared for those negotiations.
No, I like that too. It doesn't always mean, you could have somebody who's very diligent, going to take the time to go through it internally and really is asking numerous questions. And there's a lot of really talented people that could do that. We had one of our clients who had used a platform for one RFP for linen. And, it was interesting because normally he's very much involved. He's a brilliant supply chain person. He was just overwhelmed with a lot of different activities, gave the RFP for linen out. And there were some good qualities, like you said, but the labor factor was not examined close enough. And once the contract was signed and then the new vendor came in, he ended up for the first month counting towels, VP of supply chain, because the labor component was not done accurately. And of course, they had to redo it. But I just think that it speaks to really understanding, you said it so well, those sections. And I like that approach. So I want to jump to just another topic, which I actually want to give you 100% credit for this, because you utilize a multi-year strategy for purchase services, right? So this is not doing an RFP or renegotiating an agreement and then waiting for renewal 3 or 5 years. You take this multi-year strategy and you really look at what's in the middle. Now, we won't talk about what we do right now in that respect, but we believe in that. We believe what happens in the middle matters, probably, if not more important. But your approach, and I'd like you to share with everyone that multi-year strategy, because I think it's brilliant.
Yeah, and for us, it's for me with the capital background, right? Approach to any project, whether it's just ongoing capital or a construction project, but you kind of lay out, okay, we need to buy this at this time, and it's going to be here's our cash outlay. And it seems to lack a little bit in the purchase services space. And I know some folks are out there doing it, but a lot of folks, will say basically their multi-year strategy is trying to keep up with the renewals. And that's their strategy, right? So they have a spreadsheet and they say, here's my contract, and then here's where it begins and it ends. And then hopefully they're tracking if it's an auto renewal or there's a notification, things of that nature in there. That's definitely a great start, right? But there's something that happens that gets kind of lost. And that is, once you sign an agreement, and as a supply chain leader, as a negotiator, you sign an agreement, you kind of walk away, right? You say, okay, I've negotiated, I'm moving on to the next one. And I'll focus on this one in 3 years when it's up for renewal, or 5, or whatever you decided to negotiate. And you move on and you don't keep track of it. Whether it's, are they hitting the marks that we said they were going to hit when we signed the agreement? Are they the correct contracted rates? Are we getting the right discounts? And so in between period, right, between the day you sign and the day you decide to renegotiate the renewal or take it out to bid, there's a lot of action that happens in between there at a local level, right, at an end user level, right? They're delivering, they're keeping track of inventory, and all of that's data that should be captured in between. And the big reason why is, one, you want to check the performance of the contract you just negotiated, but also preps you for your next renewal, right? So what data are we capturing out of year one? Do we have the line item details of the invoices so that we could take it out to bid quickly? That just lacks a lot of times in folks' strategy. They just kind of think, okay, I've negotiated, I'll wait 3 years, I'll negotiate it again. One of the first things that they do, especially if they're going to bid, is like, okay, now I need to get all the invoice data because I need to create this analytics so that I could take it out to bid. So they know, the quantities that we're asking for. We keep using linen as an example, is, how much do they have in inventory? How much gets delivered weekly? All those things. And so we're not capturing anything in between. And so I think that's a big part of anybody's multi-year strategy, is what are you doing in between? Because multi-year strategies without an in between is just a roadmap. It's just saying, hey, this is year 1, this is year 2, year 3. But a real strategy will include things that happen in between. And I think that's a big part of the challenge when you go out to bid. And I believe it's a big enough obstacle that folks just say, I'm just going to renew because I don't have the data, I don't have the time, I don't have the manpower to get those analytics. And so I'm just going to move on to the next project and renew this one because it's the path of least resistance. And so I think the in-between strategy of that multi-year strategy is capturing the data. And like I said, just one, having it from an analytics standpoint and ready really at a drop of a dime to go negotiate, but also you could check the performance of your service providers.
Yeah, so I'm going to dig in on this conversation because I love when I hear you talking about this multi-year strategy. I actually wrote down something I heard you say, and you alluded to it now, but you're better positioned when you renegotiate. And so what happens when you're caring about the middle, like you said, you can, if you know the details that's in your 3-year agreement, you're better positioned to then either perform an RFP or renegotiate. And, and I think that what prohibits that probably is a couple of things. There's so many things supply chain's working on, and then the invoice details. The line of details are only on the invoices, but the frontline users need them. And it's interesting, in our work, we see a couple of things that happen if you're not managing the contract performance. And you can't spot check it, and you can't just look at the agreement. Or we love quarterly business reviews, and that's important. But what you're missing if you're not really looking at the line item details is the what's off contract. And believe it or not, there's quite a bit of purchase service spend that falls off contract in the term of agreement. And we don't talk about that. Errors, pricing errors. I mean, very difficult to do an AP audit in purchase services because it's not transactional. So even those pricing errors rarely get picked up unless you're tracking that or somebody's really going to be willing to go through those invoices. And I think the changes in just how that the services are performed or the amendments, all those things happen in the middle, in between. And what ends up happening is at renewal, at best, you're getting back to where you were, sometimes a lot higher because of increases, and it's just the contract gets out of hand. And I actually think that's the message I'm hoping, is that what's that multi-year strategy in one of those agreements? It's not, I've performed the renegotiation of the RFP and now we're going to wait 3 or 5 years, because that's going to be a recipe for increasing costs, right? And I just think hospitals have to really put together what goes on in the middle.
Yeah. Well, let me just say this before I forget, Rich, before you get to your comments or question. But, you brought up an example and it made me think of one for us where we did have a situation where we negotiated the contract. The end user actually started adding things to the delivery. And so that was all off contract. So by the time we caught it, which wasn't too far, it was still within the agreement, but it had gone on maybe, 60, 90 days, is they added probably like 25% line items to the agreement because they needed it. And so they weren't doing it maliciously, right? The end user is just trying to operate and they say, hey, we need these things. And so they delivered them. They were a good service provider. However, all that was not contracted. Had we not did the work in between, we wouldn't have seen it for 3 years, right? And then, you could have had an instance where by the end of the agreement, the line items, on that purchase service agreement, were only a fraction of what you started with because everything had been changed. Now, there should be action that takes place in between there. Service provider should get an amendment, things of that nature. And we would like to think that everybody does that, right? But the truth of the matter is the delivery driver, inside sales rep, and the end user, a lot of times they're just trying to operate. And so they are not thinking contract necessarily or amendment. So you could get situations just like what you described where things go off contract. And then that's just, it's not, hey, it got disconnected and we put the wrong price in there. It's, hey, you're ordering things now, or you're getting services that you were not getting in the original agreement that is now, quote unquote, off contract. But the reality is we just kind of maybe whatever changed, we just don't have it on the original agreement. And so we need to add it now.
Yeah. And I love your example because regardless of different strategies out there, whether it's benchmarking, dashboards, categorization, ratio benchmarking, RFP platform, putting on GPO agreement, all these things. I think what's the missing conversation is what's going on in between. And that's the hardest thing. 50% of the non-labor spend essentially is in purchase services, and yet we don't treat this spend like we would like implants or supplies and monitoring on a monthly basis. So this is why, you excel tremendously. I mean, you have 18 hospitals at Cornerstone, and that's a lot of managing in between. And frankly, catching it 60 or 90 days into it is remarkable. I think that's just remarkable that you did that. Richard, do you have any questions?
I really love the fact that you distinguished the multi-year roadmap to a multi-year strategy. It really just it exemplifies what really is necessary in the industry. And I know that obviously going over the past year with COVID, we've been brought in by a number of clients that really why they chose us is because we do go after and we do review midterm agreements. We do identify opportunities and do it rapidly. So I'm just curious, obviously there's been a shift in these types of thoughts and processes, but, just people in the industry, just things that have happened over the last year with COVID, not purchase services or non-purchase services, just your thoughts on what is different now versus prior to COVID and your thoughts.
Yeah, I think COVID, this is not only in the professional setting, right, but in a personal setting, right? We lost a year. Things that we would have done, we had to put off because of the circumstances. So in a professional setting, anything that you may have been working on took second priority to COVID priority, right? Which was right. It was the right move, obviously, for everyone, right? And so I think for folks picking back up from where they left off after taking some time off to focus on the pandemic is even more challenging, right? And, we had some conversions that we put on hold in, April, May, early of the pandemic period that we're picking up now that you're scratching your head and you're thinking, okay, what was the plan again? Why were we doing this, right? And so, you eventually get back there, you figure it out. But if you think about purchase services, we had a couple that we just kicked the can. We said, actually one was expiring March of 2020 that we said, just extend it 6 months. And then by then everything, we'll figure it out. And then obviously we did. And we kicked the can again 6 more months. And then we signed an agreement that, we took more time. And so you're catching up. So I think one of the biggest challenges going from today and 18 months ago is that we put a lot of things off. And now you have to pick them back up. And you have to pick up some of your 2021 initiatives, right? So if you think about purchase services, the end date didn't change because of the pandemic. The contract still expires in 2021. If you did push the 2020 renewals out, 1 year, now you have a higher volume, right, that you're having to negotiate or manage, right? And so I've told Lisa before on conversations, when I was at MD Bio, and even now, and even I say this, is, when you walk into supply chain office and you say, what's your biggest challenge? They say, I don't have enough people, right? I don't have enough people to get to. They could be large IDNs or a single, hospital. I just don't have enough folks to tackle everything we're trying to accomplish. And so I'm no different, right? I have to, whether it's your team or GPO or just another department. I've used interns, right? You get folks to come in and help you because you need the manpower. I think that's going to be a huge challenge. I think shifting your focus back to it is easy enough, but how do you actually tackle all of these problems? How do you get, I don't know, problems is the right word, but initiatives and projects that you had, how do you go after them now? And I think that's the biggest challenge is reset. And so there's that added pressure, that added metric, which isn't uncommon for supply chain. A lot of supply chain individuals are measured on some sort of cost reduction, not all of them and not solely on that metric, but that is a big part of it. And so supply chain is typically part of finance or operations. And it's no secret that finance and operations, if there's opportunities to reduce the run rate, you go after it. That helps the business. Let's generate revenue and stabilize expenses or reduce expenses. And so I think that's the biggest challenge coming out of COVID is how do I pick up where I left off? How do I do it with the folks that I have and what resources exist outside of my organization that could help me achieve those milestones or goals that we're looking to do?
Yeah, that's a great question and a great answer. I think we're going to end it there because, it's true. We have, like you said, a lot of resetting to do with COVID. And I think it's a different landscape now. So, Luis, thank you so much. I just appreciate you being on the show and the time. And you're a great mentor to a lot of people in healthcare supply chain. You're doing some great work at Cornerstone. So just thank you for carving out some time with us today. We appreciate it.
Thank you for joining Lisa Miller for this episode of the Healthcare Leadership Experience Radio Show, sponsored by VIE Healthcare Consulting. If you enjoyed the show, subscribe so you can automatically get notified when new shows premiere weekly. Don't forget to leave us a review so more healthcare leaders like you can discover us. This show is on Healthcare Now Radio, Apple Podcast, Stitcher, Spotify, Pandora, and other major podcast platforms. To reach out to Lisa personally, you can join the conversation on LinkedIn, where Lisa continues to have discussions on the business of healthcare. You can find links to Lisa's other social platforms in the show notes or at viehealthcare.com. The Healthcare Leadership Experience Radio Show is the Think Differently communication for healthcare leaders, and we are honored to have you tune in. Join us next week for another episode of the Healthcare Leadership Experience Radio Show.